Dental implants are a procedure used to replace damaged or missing teeth in the jaw. It substitutes the roots of the tooth with screw like metal with synthetic teeth that function and appear similarly like natural teeth. It is a fixed prosthesis forming a strong bond with the surrounding bone. This process is known as osseointegration. This dental implant includes a dental root, a dental crown, and an abutment. It's a must to use biomaterial specifications that are based on the mechanism of biocompatibility, meaning that the material does not have toxic or harmful effect on the biological system. Moving on to the factors that contributing to dental implant failure. The first one is the implant material. The material used in dental implant is important to their lifespan. As a result, for the long term, we must choose high quality biomaterials and it must be biocompatible. Second one is inflammation and infection. Inflammation occurs when bacteria accumulate and cause inflammation in the tissues around an implant. This may result in bone loss surrounding the implant and the implant loses its strength, eventually leading to implant failure. The third one is corrosion resistance. Corrosion is an electrochemical process that involves the transfer of electrons from one substance to another. Since the implant is exposed to the salinity, the metal will corrode. This lead to implant failure. And the last one is faulty placement of the implant. Improper implant placement can harm neighboring teeth, nerves, and blood vessels. Poor surgical technique or inappropriate implant selection may fail to integrate correctly with the surrounding bone. This can result in dental implant failure. So let's see three biometal approaches to prevent dental implant from failure for the dental root, abutment, and dental crown. So first, let's see the biomaterial approaches for dental root and abutment. The first one is titanium and its alloy. Titanium 6 aluminium 4 vanadium commonly used in dental implants and also as an abutment. Because titanium is biocompatible, it integrates effectively with surrounding bone tissue through a process called osseointegration and it can offer the strongest possible structure for the prosthetic teeth. The second one is zirconia. Zirconia is a ceramic material. It is bioinert, which means that it will never trigger chemical reaction. It is used as a dental root and also as an embodiment. It is a metal-free biomaterial and biocompatible. The speciality of this ceramic implant is that it is white in color and can provide a more natural looking. The third one is polyether ether ketone. Polyether ether ketone is indeed a polymer. It is known for its excellent mechanical properties, high temperature resistance, chemical resistance, and biocompatibility for dental root, and also for an abutment. Unlike metal implants, PEEK implants are resistant to corrosion. It is also a lightweight material. Next, let's see the biomaterial approaches for dental crown. PFM, which is known as porcelain fused metal crowns, combine the strength of a metal substructure with porcelain. A metal alloy forms the substructure which is then fused with porcelain. Porcelain fused metal crown offer both strength and a natural looking appearance. Porcelain fused metal crowns offer durability and natural looking aesthetics. As the porcelain layer can be color matched to the natural teeth, porcelain is a type of ceramic material. Next, let's see zirconia. Zirconia is a type of ceramic and popular biomaterial used for dental crowns due to its excellent strength, durability, and aesthetic properties. Zirconia crowns are made from zirconium dioxide, a ceramic material known for its high biocompatibility and natural tooth look appearance. Zirconia crowns are exceptionally strong and resistant to fracture. They can withstand the biting and chewing forces. The last one is metal alloy. These crowns are made up of metals such as nickel and chromium that are highly resistant to corrosion. Metal crowns are strong resistant to wear and long lasting. Metal alloy crowns are biocompatible, which means they are not likely to damage the opposing teeth. However, their metallic appearance make them less suitable for visible front teeth.
Hi, my name is Safina binti Mamor, and my numerator is 221151575. And today I will talk about dental crown. So, dental crown took part in implant medical device and contact with tissue or bone, and the contact duration is long term. So, in the table, we can see the X and E, and the X means prerequisite information needed for a risk assessment. On the other hand, E means endpoint to be evaluated in the risk assessment. The function of carcinogenicity test is to determine the tumor-regaining potential of medical device and biomaterial. The embryonic stem cell test (EST) utilizes the D3 mouse embryonic stem cell line to assess sensitivity of chemical on differentiating cardiomyocyte. EST involves two types of experiments, cytotoxicity test and differentiation test. The cytotoxicity test measures the viability of mouse embryonic stem cell and fibroblast cell when exposed to different concentrations of a test chemical. The differentiation test examines the impact of the test chemical on the differentiation progress of mouse embryonic stem cell. Fluorescent activity cell sorting is employed to evaluate the effect of developmental toxic chemical on cardiac differentiation markers in embryonic stem cell.
I am Sitinova Isabel Hasmadi. Today I'm going to talk about biomaterial approaches in places as abutment. When referred to ISO 10-1993 categorizing medical device according to the nature of body contact, contact duration and endpoint of biological evaluation, the concept of an abutment in category of implant medical device for contact in tissue burns with contact duration is long term. Endpoint of biological evaluation in this such as physical and chemical information, cryotoxicity, and others. But just three of these not in this evaluation: hemocompatibility, reproduction toxicity, and degradation. Acute systemic toxicity. Estimate the potential harmful effect in vivo on target tissue and organs away from the point of contact with either single or multiple exposure to medical device or biomaterial. Acute toxicity is considered to be adverse effect occurring after administration test sample within 24 hours. For the test from this acute systemic toxicity is acute oral toxicity test. This test evaluates the toxic effect of the biomaterial when administered orally. Animals, typical rodents, are administered a single dose of the biomaterial through an oral gavage or in their diet. Second, help assess the immediate adverse effect that can occur after a single oral exposure. Third, to obtain information on the biologic activity of an chemical and gain insight into its mechanism of action. And fourth, sign the abutment is intended to be placed in the oral cavity. The acute oral toxicity test is relevant for assessing the specific route of evolution. It helps determine the potential risk and toxicity of the abutment material when it comes into contact with saliva, oral tissue, and its potential swallow. Acute systemic toxicity. Estimate the potential harmful effect in vivo on target tissue and organs away from the point of contact with either single or multiple exposure to medical device or biomaterial. Acute toxicity is considered to be adverse effect occurring after administration test sample within 24 hours. For the test from this acute systemic toxicity is acute oral toxicity test. This test evaluates the toxic effect of the biomaterial when administered orally. Animals, typical rodents, are administered a single dose of the biomaterial through an oral gavage or in their diet. Second, help assess the immediate adverse effect that can occur after a single oral exposure. Third, to obtain information on the biologic activity of an chemical and gain insight into its mechanism of action. And fourth, sign the abutment is intended to be placed in the oral cavity. The acute oral toxicity test is relevant for assessing the specific route of evolution. It helps determine the potential risk and toxicity of the abutment material when it comes into contact with saliva, oral tissue, and its potential swallow.
About new dental implant innovation. We have brainstormed new ideas for better future generation implants that could perform well in curing patients with dental problems. This innovation includes easier installment, better longevity, and higher performance of implants. We are planning on developing better implants with better flexibility in each of its components or main parts. For the first component, which is the implant post, for the implant post, new innovation will include better stability after planting the implant, higher longevity, and extreme comfort. And for the second compartment, which is the abutment, for the abutment, new innovation will include better fitting as the component joiner. And the second one is the adjustable hole sizes for diversity of the crown and implant post installment. And for the third one is the prosthesis. The innovations will include higher flexibility with all of the installment of crowns, bridges, and dentures, a stronger and higher lifespan of the prosthetics, and better flexibility of the prosthesis with fashion adjustment without losing its main function. For the implant post design, the implant proposed for our dental implant will be hybrid shape to meet the innovation criteria mentioned. With hybrid shape, we are able to increase the flexibility of both the abutment and the prosthesis component. The screw will be made with materials that will match most patients' dental criteria. For the abutment design, our abutment will include higher longevity, flexibility, and comfort. This design was made to make sure that all the innovation criteria are met, where the shape is universal for diverse installment of other components with higher stability and better fit. And for the last component, which is the prosthesis design, the prosthesis will include universal fit to the abutment we design, where all type of prosthesis can fit. This include all crown, bridges, and dentures. We will also add variation of shapes and color of prosthesis that are not only look good but function better. For the biomaterial, we will be using titanium, pure titanium for most of the components of the dental implants, except for the prosthesis, as the fashion variety will be limited when titanium is used for the crown, bridges, and dentures. The properties of the titanium is from the mechanical properties. It has excellent ductility, which is the ability of a material to have its shape change without losing strength or breaking. The second one is excellent tensile strength, which is the maximum stress that a material can bear without breaking when it is allowed to be stretched or pulled. For the chemical properties, it has low thermal conductivity, which indicates a good insulating material. And for the second one is a high electrical conductivity, and the third one is inert, which is chemically unreactive. For the morphological properties, the material is parametric, which is weakly attracted to magnet, and the second one is lustrous, shiny material, and the third one is it has low density.